I too would like to thank you for being here. I'm Mike Beediger. I'm President and Chief Executive Officer of Lexington Medical Center. And we believe this agreement is an excellent arrangement for both hospitals, but more importantly for the people that the hospitals serve, the people in the Greater Midlands area, as well as, and especially, we believe, the people in the Lexington community. The mission of our hospital has always been to provide quality services and meet the needs of our community, and this is an effort geared towards that mission statement. We've also tried to have good geographical distribution of our services so that the care is readily available to our patients. And so many of you know we have outpatient facilities throughout Lexington County, and as far as Batesburg, Leesville, Swansea, Chapin, and so forth. And we feel like this agreement, by helping us provide cardiac care here, will make those services, again, geographically closer to our patients, where we can better serve our patients. Many of you know we have the second busiest emergency department in South Carolina, where we see almost 90,000 patients per year. We have a network of urgent care centers where we treat almost 150,000 patients per year, many of those with cardiac symptoms. And so this is going to be a tremendous benefit to our community. This agreement will help us to move forward more quickly, we believe, than we would have on an otherwise basis. And I've certainly enjoyed the opportunity to work with Michael and George and the Providence staff as we crafted this agreement, and look forward to providing improved services in our community.
Thank you, Mike. I would also echo my appreciation of the support from all parties. As an outsider coming to the community and not being a part of the original debates and dialogue, it became very clear to me, and I think one of the first meetings I had with anybody in the Midlands was with Michael. And he really was very helpful in trying to educate me as to what the historical perspective was. And as we left that first meeting, it became very clear to the two of us that we need to find some other solution to this contentious relationship that's going on. On a personal basis, I have a strong philosophy that hospitals across this country, facing some of the challenges that we're seeing as a country in terms of healthcare, have got to find a foundational base to work more collaboratively and be better aligned. Continuing in a contentious lawsuit and challenging one another was not going to develop the trust and the foundation. So much of what's going on over the last several months is creating understanding among two parties. And once you understand another person in the context of the relationship, you begin to trust. You begin to see some progress and look at things differently than you might normally have. And at the end of the day, we really felt that Lexington County has done a marvelous job securing a lot of its healthcare needs through this organization. And as they look at the continued needs of Lexington County, we needed to find a way to be supportive of that growth as we go forward. So it is a new day, it is a beginning, and an opportunity for us to look at issues facing the Midlands in a much more positive construct than in a legal battle that we've been involved in for the last several years.
Any questions?
What's the mechanism? What's the reason for moving essentially one surgery from one will be removed at Providence and will go and one will be added in Lexington? That's to meet the state mandate, I understand it, for how many there can be in the Midlands. Is that correct? And what will be the effect on Providence, if any?
Well, as far as the state health plan, we would plan to do a joint application for a certificate of need. And again, where Providence would de-license one open heart surgery suite, while simultaneously DHEC would hopefully approve one open heart surgery suite for us. We would apply to the same criteria that we applied last time, which is what we call the single county exception, which in the state health plan it says that there's a county that doesn't have open heart surgery and a hospital doing 1,200 or more diagnostic casts per year, DHEC may grant approval. That was a criteria where DHEC had the discretion to grant or not grant the approval. They chose to not grant it 5 years ago because they didn't want to add another room. This helps solve that problem, that we would not be asking to add another room to the capacity. So capacity wouldn't improve, but the geographical access would improve. And so So that's our goal there, where we believe it's, would be a more attractive proposal for DHEC to approve.
There's no question that from a historical perspective, Providence has had a nationally recognized open heart program, and we don't see any of that changing. What will probably change by delicensing one of our facilities, one of our ORs, is that patients that are now coming to Providence from Lexington County with an open heart program being available in the community, incrementally there's apt to be some of that volume that will move from our facility to Lexington. In terms of how we operate, how we continue to serve the patients that we that we do at Providence, it will require a little bit of creativeness on our schedule and how we manage 3 ORs instead of 4. We think we can handle that, and the important thing from our perspective is that we're not going to add unnecessary capacity to the marketplace. We're looking at shifting some of that capacity that realistically is from this county.
Will admitting privileges for Providence doctors be granted here into that new OR?
Well, the Providence cardiac surgeons already have privileges here. They already have privileges here. And the reason why they've had privileges is so they can visit some of the prospective cardiac surgery patients. They can actually come and visit here. So they already have privileges.
Just as an aside, there are quite a few members of our medical staff at Providence, cardiologists, other specialists that also have privileges here, and that's somewhat typical, and also I think into the future is a positive element, because then you're not restricted from where you're going to serve the needs of the patients.
Because you're going to have the same number of overall suites in the community, how does that address Providence's past concerns about diluting experience in open heart surgery by having it spread out? That was one of the original arguments.
You know, good question. We spent a lot of time discussing this issue, and here's a reality. When Baptist started their heart program, they had no experience base. They went for a thoughtful, well-organized approach in bringing those services to their organization, and I would be the first to admit that they have an excellent cardiac program. Historically, Lexington, and we talked about this, have introduced all kinds of services to this community, and they started with nothing and grew it to something that has a very strong regional and in some cases national recognition in terms of awards for what they do. We have come to the same view that they're not going to look at developing an open heart program with any less effort than they have in other things, and we will be in a position to be available as a resource to them as they go through that process. You walk before you run, and I won't speak for Michael, but I know that they have looked at this as well as other programs with a real sense of focus on quality and making sure that they don't compromise the patients in the process.
George, I appreciate the kind words that you said about Lexington Medical Center, and I believe that to be true. We've got excellent programs in vascular surgery and orthopedics and a number of other areas. We've got a center of excellence in bariatric surgery that's recognized by Medicare, by the American College of Bariatric Surgeons, by Blue Cross, by United Health. We've got an accredited cancer program that received commendation upon the surveys. And so the way we would plan to approach this, we've also got, in our total employee base, which we currently employ about 5,100 employees, of those about 1,200 are nurses. And many of those nurses come from all over the country. And many of those nurses have experience in cardiac intensive care, in cardiac surgery. We have scrub techs with experience in cardiac surgery and so forth. What we would also plan to do is to visit some of the premier institutions in the country to see how they do it and to make sure that we do it on a par or better than they do. But we believe Lexington Medical Center has a reputation for quality, and that's the same way we plan to approach open heart surgery.